Hello everyone. On today's topic, we'll be talking about the bronchopulmonary segments, and I am Fatima Shahala Munaz. This shows where the lungs are situated in the body. It's situated in the thorax. And we talk about the borders and surfaces of the lungs. We have the apex, base or the inferior surface, the three borders, anterior, posterior and inferior borders, and two surfaces, costal, medial, with medial being vertebral and mediastinal. We'd move on to the anatomic characteristics of the lobes of the lungs. So the right lung has three lobes. The right upper lobe or the superior lobe has large anterior projection, three segments. It's smaller than the left upper lobe. The middle lobe or the middle lobe only has anterior projection. It has two segments and is wedge-shaped in outline. The right lower lobe or the inferior lobe lies inferior and posterior to the oblique major fissure. Five segments. Inferior surface lies above the diaphragmatic dome, the diaphragmatic surface. The left lung consists of two lobes, the left upper lobe and the left lower lobe, or the superior and inferior lobes. The left upper lobe is much bigger than the right upper lobe. It has large anterior projection, supplies four segments, has a wide cardiac notch anteriorly, has lingula, which is a small tongue-like projection. Left lower lobe or the inferior lobe is larger than the upper lobe. It lies inferior and posterior to the oblique major fissure, supplies four segments. Moving on to surface anatomy. We have the horizontal fissure, the surface marking of parietal pleura of the 8th, 10th and 12th ribs. It has a cervical pleura, anterior margin, inferior margin and the posterior margin. Then we have the oblique fissure, with the surface marking of the lungs from the 6th, 8th and 10th ribs, apex of the lung, anterior border, inferior border, posterior border. We also have the major interlobar fissure and the minor interlobar fissure. Structures of the hilum of lung. Both lungs, anterior to posterior, they contain the pulmonary vein, pulmonary artery and the bronchus in order. When seen between the right and the left lung, from the right lung superior to inferiorly, firstly we have the eparterial bronchus and then the pulmonary artery, hyparterial bronchus and then the pulmonary vein. In the left lung, from superior to inferior, we have pulmonary artery, principal bronchus and the pulmonary vein. Next, we talk about the bronchopulmonary segments of the lungs. Each segmental bronchus passes to a structurally and functionally independent unit of lung lobe called a bronchopulmonary segment. These are well-defined anatomic, functional and surgical units of the lungs. This picture signifies the bronchopulmonary segments of the lungs in lateral views. Airway progression. So trachea, 16 to 20 C-shaped hyaline cartilage rings bifurcates at the level of sternal angle. Then we have the carina, ridge on the internal aspect of last cartilage, point where the trachea branches. The left main bronchus, which is the longer one, which is about 5 centimeters long, it's smaller in diameter and it's more horizontal, makes an angle of about 45 degrees with the trachea, and gives two lobar bronchi. Right main bronchus is shorter, about 2.5 centimeters, larger diameter, more vertical though, with 45 degrees. More susceptible to aspiration, gives three lobar bronchi. Each main or primary bronchus runs into the hilus of lung posterior to pulmonary vessels. Segmental bronchus divides into subsegmental bronchi. Subsegmental bronchus divides into bronchioles. Tubes smaller than 1 millimeter diameter called bronchioles. The smallest terminal bronchioles are less than 0.5 millimeters diameter. Bronchioles have no cartilage. Respiratory bronchioles, two or more branches from each terminal bronchioles with air sacs buds. This is the first level of gas exchange. Respiratory bronchioles end in alveoli. pores of Kahn and channels of Lambert are present to connect two alveoli. When we talk about the bronchopulmonary segments, we must notice that they have well-defined sectors of lungs. They're pyramidal and apex is always towards the hilum. There's 10 in each. They contain segmental bronchus, pulmonary and bronchial artery branch. Pulmonary vein is intersegmental, independent bronchopulmonary unit, but not an individual bronchovascular unit. We talk about the characteristics of bronchopulmonary segments. The largest subdivision of a lung lobe. Pyramidal in shape with apex towards the root of hilum. Each segment is an independent respiratory unit. Each segment has its own separate artery, branches of pulmonary artery for example, and then segmental bronchus, autonomic nerves, and lymph vessels. The segmental vein runs in the connective tissue adjacent to bronchopulmonary segments. Thus, a bronchopulmonary segment is not a bronchovascular segment as it does not have its own vein. Usually the infection of bronchopulmonary segments remains restricted to it, although tuberculosis and bronchogenic carcinoma may spread from one segment to another. Moving on, we talk about the nomenclature of bronchopulmonary segments. We have the right lung bronchopulmonary segments. The upper lobe has apical, anterior and posterior. The middle lobe has medial and lateral. The lower lobe has superior, medial basal, anterior basal, lateral basal, and posterior basal. The left lung. The upper lobe has apical, anterior, posterior, superior lingular, inferior lingular, and the lower lobe has superior, medial basal, anterior basal, lateral basal, and posterior basal. This image shows the trachea and major bronchi. Now we talk about the blood supply. When talking about the blood supply, we start by talking about the arterial blood supply. It's supplied by the bronchial artery. The right side has one branch of the third posterior intercostal artery, and the left side has two branches of descending thoracic aorta. And then when we talk about the venous blood supply, the right side has two bronchial veins which drains into the azygos vein, and the left side has two bronchial veins which drains into the hemiazygos vein. The lungs mainly are drained by pulmonary veins, the superior and inferior. This image shows a picture of the bronchial arteries. Next we talk about the lymphatic drainage. Lymphatic drainage. It has superficial nodes, superficial bronchopulmonary nodes in the hilum, and then they have tracheobronchial nodes in the tracheal bifurcation, which supply to the right subclavian trunk and the left thoracic duct. We also have the deep lymph nodes with pulmonary lymph nodes and bronchopulmonary nodes, and to the tracheobronchial nodes, which again go to the right subclavian trunk and the left thoracic duct. The alveoli has no lymphatics around them. This image shows a picture of the lymph nodes. Now we talk about the nervous supply. Anterior and posterior pulmonary plexus. In the peripheral nervous system, we have the vagal fibers, motor to bronchial muscles, and glands are sensory. Sympathetic T2 to T5 spinal segments. Lastly, we talk about the applied aspects of bronchopulmonary segments. The applied aspects include segmentectomy, bronchiectasis, lung abscess, and benign tumors. Then we've got bronchoscopy and removal of foreign body. Then we have postural drainage, lung abscess, and tuberculosis lung. We also have bronchiectasis, chronic dilatation of bronchi with secondary infection. Emphysema, distal to terminal bronchioles distension with destructive changes in the walls. And lung carcinoma.